So we are going to discuss about the adrenal hormones, the physiological functions of adrenal gland hormones, mainly the adrenal cortical hormones. Lecture outline. So today we are going to discuss the main functions of adrenal cortical hormones and the regulation of cortisol secretion and the aldosterone secretions and some of the disorders related to the adrenal hormones, for example Cushing syndrome, primary aldosteronism and Addison's disease. So this is a cross sections of adrenal gland. So you can see outer cortex. So cortex has three layers: zona glomerulosa, zona fasciculata and zona reticularis, and the inner medulla. So this is the cross section of adrenal gland. So adrenal cortex secrete three types of hormone: glucocorticoids and the mineralocorticoids, that is the aldosterone and the adrenal androgens. All these hormones are steroid hormones, remember that. So adrenal medulla secrete mainly the catecholamines, mainly the epinephrine, norepinephrine and dopamine. So you have already discussed about the functions of adrenal medullary hormones, these epinephrine, norepinephrine, in first module under the lecture of autonomic nerve systems. Therefore, we are not going to today discuss about these hormones. We are going to focus on the functions of adrenal cortical hormones. So what are the functions of adrenal cortical hormone? First one, glucocorticoids. So by name you know. So glucose, it involves in glucose metabolism and the protein metabolism. Mineralocorticoids are more concerned with minerals, example sodium and potassium. Thereby it maintain the extracellular fluid volume. At the sex hormones, adrenal androgen, however, it shows minor effects on reproductive functions because the ovaries and testes produce more androgens. And the mineralocorticoids and glucocorticoids are really necessary for the survival, and we will discuss about this later when we discuss the Addisonian crisis. So when you compare the activity of these adrenal gland hormones, so all of these hormones shows dual activity, glucocorticoid activity and the mineralocorticoid activity. So for example, cortisol predominantly show the glucocorticoid activity but less effect on minerals, whereas the aldosterone predominantly shows the mineralocorticoid activity and less effects on glucocorticoid activity. So what are the main functions of glucocorticoids? So their function on carbohydrate metabolism. So their main function is to increase the blood glucose level. For that, it increases the gluconeogenesis or the glucose production by the liver, and it decreases the glucose utilization by cells, as well as it antagonizes the insulin effects. So you know the functions of insulin, their function is to decrease the blood glucose level. However, the cortisol antagonize or block the action of insulin, thereby try to increase the blood glucose level. And what are the functions of fat metabolism? So it try to mobilize the fatty acids already stored in adipose tissue, in peripheral tissues like limbs, right? And it increase the oxidation of fatty acid and use the fatty acids to produce energy as a fuel. And the rest of the fatty acid again deposited in the central abdominal area or your tummy area. So that is known as fat free distribution. And then protein metabolism. It decrease the synthesis of protein while it increase the protein catabolism. So it has a protein catabolic effect, right? Remember that. And what are the functions of mineralocorticoids? The main mineralocorticoid secreted by the adrenal gland is the aldosterone. So it actually increases the sodium reabsorption while increase secretion of potassium into the urine. Thereby its main aim is to increase the extracellular sodium level and decrease the potassium level. And you know, the sodium absorption in the kidney is followed by water absorption. Therefore, it increases the extracellular fluid volume. Then the regulation of cortisol secretions. So regulation of cortisol secretion is under the control of hypothalamus pituitary adrenal axis, HPA axis. So the hypothalamus is responsible to secrete corticotropin releasing hormone which act on the anterior pituitary and stimulate to secrete the ACTH, adrenocorticotropin hormone. Then the ACTH act on the adrenal cortex and stimulate the cortex to produce cortisol. Then the cortisol has the feedback effect on anterior pituitary and the hypothalamus. For example, if there is excess level of cortisol in the bloodstream, it inhibits the anterior pituitary and hypothalamus and reduces its secretion. Though the cortisol has a circadian rhythm, right? So where there is a natural secretion of cortisol due to the stimulation of the ACTH burst, right? ACTH burst. These ACTH bursts are more frequent during the morning hours. Therefore, we can see high level of cortisol during morning hours but less level during evening. In addition to the circadian rhythm, the cortisol can be secreted during a stressful situation, for example, trauma and infections. In these conditions, the blood glucose level should be high. Therefore, to prepare the body just to face the trauma and infection in stressful situation, the cortisol should be high. And regulation of aldosterone secretion. Though the cortisol secretion is under the control of hypothalamus pituitary adrenal axis, aldosterone actually the main stimulator for the aldosterone secretion is renin-angiotensinogen system. It is not the hypothalamus pituitary adrenal axis, right? So due to the whatever the reason, if the angiotensinogen system get activated, it can stimulate the adrenal cortex to secrete the aldosterone. So what are the clinical syndrome related to the adrenal hormones? Example, Cushing syndrome, where you can see excess glucocorticoid secretion or excess level of cortisol. So what are the symptoms and signs you can see in a patient with Cushing? So if you know the normal functions of cortisol, then you can apply that knowledge to describe the symptoms and signs that the patient would develop. So Cushing syndrome, the patient can develop the fat redistribution symptoms, for example, moon phase and truncal obesity. So this is due to the deposition of excess fat. You know, the fat is mobilized from the peripheral tissues and then get deposited in the truncal area, the tummy, the central abdomen and the face. Then the face become moon face and the patient can have thin limbs with big tummy. So it's kind of truncal obesity due to the fat redistribution. And again, the fat can be deposited at the back of the neck. So it is called the buffalo hump, right, due to the fat redistribution. In addition to that, the patient can get purple abdominal striae. How? So you can see there are purple striation over the abdomen. So it is due to the increased protein catabolism, right? So when the protein catabolism happens in the skin becomes very thin and it increases its stretchability. Therefore, you can see the striation like that, right? Not only that, even you can face the thin skin area, therefore there's redness. Addition, you can get hypertension. The patient with Cushing syndrome can get hypertension. So it is due to, you know, the cortisol has dual action, mineralocorticoids and the glucocorticoids. Predominantly it shows the glucocorticoid activity. So it can show the minor effect on minerals. Therefore, due to the absorption of sodium, so you can get high level of extracellular fluid because the sodium absorption is followed by the water absorption. So high level of ECF fluid can lead to the hypertension later. Other one, the osteoporosis. How? So you know the bone is made up of matrix on top of that the calcium and the phosphorus get deposited. The matrix consists of protein. So when the protein catabolism increase in the bones, right, the bone become very weak and fragile. So these type of patients have more prone to develop fractures. Diabetes mellitus, you know, the normal function of cortisol is to increase the blood glucose level. So when there is excess level of cortisol, it exaggerates its effects, leading to hyperglycemia, and later patient can go into the diabetes mellitus. And the recurrent infection. This is because, you know, the cortisol, the adrenal cortical hormones are steroids. Steroids have several functions. One function is an anti-inflammatory action. So anti-inflammation, so it can actually suppress some of the inflammation going in our body. In addition to that, it has it can suppress the immunity, understand, immunity. So when the immunity is suppressed, the patient is more prone to get infections and they become recurrent, right? And some of the patients have poor wound healing due to the effects of excess steroids in the body, that is cortisol. So this is just to show you the illustration of the symptoms and signs of the patient with Cushing. Due to the fat redistribution, you can see here the patient can get moon face, fats, and the pendulous abdomen here, right? And because of thin skin, patient can get striation due to increased protein catabolism. And the bruisability, because the protein catabolism not only increase in the skin and the muscle, it can increase even in the blood vessels. Then the blood vessel wall become very thin and fragile. So when you hit over the skin, so there could be some bleeding under the skin, showing some ecchymotic patch, right? And the muscle, they become very poor. Why? Due to increased protein catabolism in the muscles. And due to the immunosuppression, the patient can have the poor wound healing. These are the symptoms and signs of Cushing syndrome. And there are two types of Cushing, the ACTH-dependent Cushing syndrome and ACTH-independent Cushing's. So ACTH-dependent Cushing's, where you can see excess level of cortisol secretion due to the excess level of ACTH secretion. In the ACTH-independent Cushing syndrome, actually the cortisol level is high, but ACTH level can be normal, right? So read on this. Excess mineralocorticoid secretion. So far we discussed the excess glucocorticoid secretion, that is excess level of cortisol, for example Cushing. So this is due to the excess mineralocorticoid secretion. So that is primary aldosteronism or Horn syndrome, where you get high level of aldosterone. So aldosterone action is to increase the secretion of potassium by the kidney tubules. Therefore, the patient can go into the hypokalemic situation. Other one is it can increase the sodium absorption, and the sodium absorption is followed by the water absorption. So the extracellular fluid volume increase. Therefore, ultimately patient can go into the hypertension. Other one. So far we discussed the high level of adrenal hormone secretion, Cushing, and the primary aldosteronism. So this is primary adrenal insufficiency, where you can see lack of hormone, so deficiency of adrenal glands hormone. So this is known as Addison's disease. So for example, if there is tuberculosis infection, TB infection in the adrenal cortex, it can disrupt the adrenal cortex and go into the hormone deficiency, Addison's disease. So then the patient can go into these symptoms and signs. So due to the deficiency of aldosterone, so the excess amount of sodium can get lost through the urine, and the sodium is followed by the water. Therefore, there could be water loss. Due to the water loss, the extracellular fluid volume can decrease and your weight can reduce. In addition to that, due to the loss of water, due to the reduction of extracellular fluid volume, patient can even go into the hypotension and shock, that is known as Addisonian crisis situation, right? And not only that, so the potassium secretion, the potassium reabsorption reduce, so the hyponatremia, and the sodium secretion reduce, sodium absorption reduce, therefore patient can go into the hyponatremia, and the potassium secretion reduce, therefore patient can have hyperkalemic situation. These conditions can cause arrhythmia and sometimes cardiac arrest. Other one, the fasting cause fetal hypoglycemia, So one of the functions of the cortisol is to increase the blood glucose level. If the patient is under the fasting, or if the patient can face any stressful situation, the patient can go into the hypoglycemia due to the lack of cortisol. And if there is lower level of cortisol, right, due to the positive feedback effects, now what happens, the ACTH level increase, right? And when the ACTH level increase, actually it can cause pigmentation in the mucosa, the buccal pigmentation, and read on that how does it happen, right? The summary, actually we discussed the functions of glucocorticoids, and we discussed the functions of mineralocorticoids, and we discussed the regulation of aldosterone secretion and the regulation of cortisol secretion, and we discussed some of the disorders related to the adrenal cortical hormone Cushing syndrome, excess level of cortisol secretion, and the aldosteronism, excess level of aldosterone secretions, and deficiency of all these hormones, that is Addison's disease. So thank you.